talking about clavipectoral fascia, as the name suggests, the clavipectoral fascia, the fascia which is extending from the clavicle and it is going on to the pectoral region, covering a pectoralis minor muscle also. Let us discuss this a topic on this diagram given picture here, and then we will draw it and also we'll see into more details in here. Now, if I enlarge this picture for you, what you will see that look at this translucent fascia that you can see, which is extending all the way from clavicle until the floor of the axilla. This here is the clavipectoral fascia. As you can clearly see, the muscle which is enclosed in the clavipectoral fascia is this one here, that is the pectoralis minor muscle. This here is the pectoralis minor muscle. And another muscle which is not very clearly seen in this, but I hope you can recognize the muscle below the clavicle there, that is a subclavius. This muscle here, the one which is below the clavicle, is the subclavius. So that's first important information, that the two muscles enclosed in the clavipectoral fascia is the pectoralis minor and subclavius. You can see this clavipectoral fascia after removing the pectoralis major muscle. So major is being removed from here. You can see the cut end of the pectoralis major muscle, and then you can see the pectoralis minor coming from third, fourth and fifth rib and attached to the coracoid process, which is inside this fascia. The two important questions from the clavipectoral fascia are that number one, what are the structures which are piercing the clavipectoral fascia? Now this clavipectoral fascia, there are certain structures which need to go inside, some has to come outside. So you can see there are some tough structures which are piercing it. Second important question here is about the extension. Do we have any extension of clavipectoral fascia below as well as above? And yes, we do have extension above and below. If you look into the lower part, the same clavipectoral fascia below pectoralis minor muscle is extending as this suspensory ligament of the axilla. Guys, if you look at the floor of axilla is not flat, it is slightly domed. And why it is a bit dome shaped? Because this suspensory ligament of axilla is pulling it up. This is a suspensory ligament of axilla you're looking at here, which is nothing but the extension of what? Clavipectoral fascia only. So this here is the suspensory ligament of axilla. This one is the suspensory ligament of axilla. And finally, do we have extension of clavipectoral fascia above as well? Yes, we do have extension above as well, and that is behind the clavicle. Now what you see, this clavipectoral fascia is enclosing the subclavius muscle. So obviously subclavius muscle is somewhere here, and you can see this clavipectoral fascia will be enclosing it, having one anterior layer and posterior layer. Now the posterior layer, not the anterior, the posterior layer of clavipectoral fascia behind the clavicle will continue above and will continue with the investing layer of deep cervical fascia. We talk about investing layer of deep cervical fascia in the neck. So that same investing layer of deep cervical fascia, it continues behind the clavicle with the posterior layer of clavipectoral fascia. So these are some facts that you should know about the clavipectoral fascia. Let's draw it and write about these details as well. Now, to understand this in a different way, because if I draw the same diagram for you, that will not be very fruitful. You've already seen it here. Let us draw the same thing but in a sagittal section, because that will help us to understand the boundaries of axilla also. So now I want you to imagine, if you take a sagittal section from the level of axilla, then what are the structures you expect to see here, guys? Imagine this section is taken something like this. So what are the anterior wall? What is the anterior axillary fold made up of? Now this anterior axillary fold is made up of pectoralis major muscle, and obviously once you remove it, you have pectoralis minor muscle. So when you take a sagittal section and see it from the side, so anteriorly you will see pectoralis major and minor muscle, then you will see the axilla, the space in between axilla, and then you will see the muscle which are forming the posterior wall of axilla, the posterior axillary fold like subscapularis. So while discussing the clavipectoral fascia, let us also try to understand a little bit about the boundaries of the axilla also. So that is why I suggest you to go with the sagittal section here. So if you go with the sagittal section of the axillary region, see, that's how it goes. This is a sagittal section here, and in the beginning only, let me tell you for the orientation sake, in this diagram, this side is going to be anterior, this is posterior, that is superior, and here is inferior here. That is superior, inferior, anterior and posterior. That's how you have to imagine this section. So like I'm turning in this way and taking sagittal section. So you have anterior, posterior, superior and inferior. Okay. Now what you already know, that anterior wall let us say this is a clavicle here. Anterior wall, the muscle which are present in the anterior wall, one is the pectoralis major. That's a big muscle here. That's a pectoralis major muscle. And then we have a muscle which is present below the clavicle, that is subclavius. Whereas pectoralis minor muscle, which is coming from third, fourth and fifth rib, will be also seen behind the pectoralis major only. So this here is the major, that is the pectoralis major muscle. This is subclavius and this one is pectoralis minor. Let's label these muscles. That is the major, the pectoralis major. This one here is subclavius and that is pectoralis minor. We can draw few more things in it if you want. Like if you look at the posterior wall of the axilla, this everything is in the anterior wall here. If you look at the posterior wall of axilla, it is by the muscle like subscapularis, teres major, latissimus dorsi. As you keep going down, that these are three subsequent muscles that you will see in the posterior wall. But let's not draw it here because we don't need it for this topic. Now we said the subclavius muscle is enclosed in this fascia. Look at this green colored fascia I'm drawing. That is a clavipectoral fascia covering subclavius. Then extending down here, covering what muscle? That is covering the pectoralis minor. And then it is again extending downward and reaching till the floor of the axilla as a suspensory ligament of axilla. So guys, this here is the clavipectoral fascia. This is the one we are talking about, the CPF, the clavipectoral fascia. And this is the extension of the clavipectoral fascia. And that extension was what? That was the suspensory ligament of axilla. That extension below is a suspensory ligament of axilla which pulls the floor of the axilla, and as I said, will make the floor of axilla looks like slightly a dome. Suspensory ligament of axilla. We also said we have a continuation of this clavipectoral fascia above as well. Now this posterior layer, let me just point it out here. This posterior layer of clavipectoral fascia above this one will continue. It will continue with the investing layer of what? Investing layer of deep cervical fascia, DCF I'm writing. The posterior layer of clavipectoral fascia behind and above the clavicle will continue with the investing layer of deep cervical fascia. So these are some anatomical details you should know about this fascia in there. Then the question was about that what are the structures piercing clavipectoral fascia. Now I'm going to show you the picture first and then I'll write it down for you. Let me again show you the same image in which we saw how the structures are piercing it. Now as I said, some things, there are certain structures which need to go inside and some have to come out. Like look at this picture once again, guys. Now can you see the vein over there? The vein on the lateral side is what? That is a cephalic vein. So cephalic vein is the one which is running in there and going inside, piercing the clavipectoral fascia. That is number one. If you look very carefully, you can see some blood vessel is coming out here. We talked about this blood vessel in the axillary artery. From the second part of axillary artery, there was a branch coming out called as a thoracoacromial trunk, which further divides into 4 branches. So that's a thoracoacromial trunk coming out, and you can see all the 4 branches can be seen here. The deltoid branch, the acromion branch, the pectoral branch. So overall, thoracoacromial trunk is the one which is coming out. Cephalic was going in, thoracoacromial trunk is coming out. You can even see a nerve over there. Can you see a nerve coming out? Now this nerve coming out is coming from the lateral cord of the brachial plexus, and the nerve is a lateral pectoral nerve. And why this lateral pectoral nerve is coming out? Because it comes out, it pierces the clavipectoral fascia and supplies pectoralis major muscle. Pectoralis major muscle is outside here. This whole muscle outside will be pectoralis major. So this nerve is coming out from the brachial plexus, from the lateral cord of brachial plexus, to supply the pectoralis major muscle. So 3 structures can be clearly seen in there. Now we also have some lymphatics. There are some lymphatics which will be running and piercing the clavipectoral fascia, going inside to drain into the apical group of axillary lymph nodes. There are we have so many lymph nodes inside. We have a group of apical lymph nodes. So some lymphatics will be piercing through this fascia to go inside and drain into those. So we have one vein. You saw that, the cephalic vein. We got an artery, the thoracoacromial artery. We got a nerve. What nerve? That is the lateral pectoral nerve. And we also got certain lymphatics which are piercing and going inside here. Let me try to show the same thing just for your better orientation in the same sagittal section that we just discussed. We don't have to draw it, just I can try to appreciate it in there, guys. That's a kind of picture that we drew. It's the same kind of section, guys. Imagine, look at this once again here. You can see there is a clavicle, the section of clavicle. Can you see a muscle subclavis over there? That is a subclavis muscle. This muscle here is a pectoralis minor, that is pectoralis minor muscle, and this is pectoralis major. Right? Let me just write in short only. This is P major, that is pectoralis major here. That small muscle over there, that is the subclavius. And this muscle here is the P minor, that is pectoralis minor. And obviously, I told you that on the posterior wall of the axilla, you have the muscle like subscapularis. This here is a subscapularis muscle that I'm pointing at. The one that you see below that, that is teres major muscle. Further below you go, that is latissimus dorsi. So these are the muscle on the posterior wall. And this in between are the contents of the axilla, like axillary artery, axillary vein, and the cords of brachial plexus. Can you see? Now look at that. That is a lateral cord of brachial plexus there, guys. Look at this. That's a lateral cord of brachial plexus. And you can see from the lateral cord of brachial plexus nerve coming out, that is a lateral pectoral nerve piercing the clavipectoral fascia. Can you see that? It is piercing the clavipectoral fascia to supply pectoralis major. We just said that. You can see a branch from the axillary artery is also piercing it and then coming out here. You can also see a vein, cephalic vein is piercing it and going inside and draining in. So these are the structures which can be seen, and you can very well make out that why they are piercing, because certain like vein and lymphatic has to drain inside, nerve and artery has to come outside to supply. So that's why these are the structures needed to pierce the clavipectoral fascia. So let's pen it down. We said structures piercing the clavipectoral fascia. So remember it like this only, that we have 1, 1, 1, 1. Everything is 1. Like starting with, we got one vein. What vein was that? That was the cephalic vein. Cephalic vein was there. Then artery, that was thoracoacromial artery. Thoracoacromial trunk, you can say, or thoracoacromial artery, same thing. Nerve, what nerve is coming out from the lateral cord? That was a lateral pectoral nerve. We got a lateral pectoral nerve supplying pectoralis major coming out. And finally, we got lymphatics. Lymphatics, the one which are draining into the apical group of lymph node. Apical group of axillary lymph node, to be more precise. Apical group of axillary lymph node. So these are the structures piercing the clavipectoral fascia. So that is about the fascia here. That's an important question. They do ask this question in a image-based manner also, and they can ask this question as a simply question that what structures are piercing it, what are the continuation of the fascia above and below. Now guys, let's talk about some spaces which are present between the scapula and the humerus. We call them intermuscular scapular spaces, or simply the scapular spaces. So we got the muscles which are stretching from the lateral border of the scapula and going toward the humerus. And that's how they create certain spaces in between, the quadrangular space and two are the triangular space. And we got to see that what are the contents of those spaces and what are the boundaries in there. Having discussed about the contents of the axilla, also about the axillary blood vessels, so it is a bit easy for us to understand and remember that what are the contents we have in the intermuscular scapular spaces. To understand that topic, I'm going to show you the scapula and the humerus from the posterior aspect. Now let us imagine this here is the scapula. And I'm just drawing the spine of the scapula so that we can say this is the posterior view, right? And this is the humerus. Well, if you're drawing it with me, make sure draw the humerus slightly abducted. It will be easy for you to follow the diagram then. So that's a humerus in there. So we got to looking at a scapula and the humerus. Now, as we said, there are certain muscles which are coming from the lateral border of the scapula is meant for the origins only. We have all the origins from the lateral border and we have all the insertions on the medial border. Like from the lateral border, we got a muscle here that is teres minor and teres major, both originating. Now, this teres minor muscle will be going to the greater tubercle, to the lower lip of the greater tubercle like this. That is a teres minor muscle. Let me just fill it up. That is teres minor. And then from below we have a teres major muscle which will be going anteriorly to the medial lip of bicipital groove. This view is from the posterior side. So please understand what I'm trying to say, that teres major muscle, though it is originating from the posterior surface along the lateral border, but ultimately the muscle, if you see, muscle is going anterior to the humerus. That is going like anterior to the humerus to the medial lip of the bicipital groove. Teres minor and teres major. Now the most important muscle to draw here, and you have to be very careful with that, is a long head of triceps. The long head of triceps muscle, it originates from the infraglenoid tubercle, somewhere from here. And then this long head of triceps will come down like this and will pass behind this tendon, that is a tendon of the teres major muscle, and will go toward the humerus here. But make sure when you draw this, leave the spaces in between. That's how the intermuscular spaces are being formed. So what I'm saying is the muscle will be coming somewhere in this manner from the infraglenoid tubercle like this. That muscle here is a long head of triceps. As we all know, triceps having 3 head, and out of the 3 head, the only head of tricep which is coming from scapula, from the infraglenoid tubercle of the scapula, is the long head. The remaining 2 head, medial head and lateral head of triceps, are from humerus only. So it's just the long head of triceps which is to be seen. So even before I label this, please make sure that you have these 3 spaces in between. That is what? That is a quadrangular space, as you can see. This here is a triangular space. We call it upper triangular space. And this again is a triangular space, but below, so we call it a lower triangular space here. Let's now label these muscles. This here is the teres minor. The one below here is teres major. This is the long head of triceps, sorry, the long head of triceps brachii. And we have the 3 spaces in there. So let us start from these 3 spaces. See, I don't have to tell you what are the boundaries of these spaces. That is very obvious. If you look at the quadrangular space here, lateral side where we have humerus, medially we have this long head, above we have teres minor, below we have teres major. So there's no point in writing out these boundaries separately. Boundaries are pretty clear in the diagram itself. The main thing is, what are the contents of these spaces? Well, you know the contents of all the 3 spaces, and we already discussed that in the blood vessels itself. Now this portion, this quadrangular space, is very close to the surgical neck of humerus, and the blood vessel which winds posteriorly along the surgical neck of humerus is posterior circumflex humeral artery. And we already discussed that along with the posterior circumflex humeral artery, what nerve will be there? Axillary nerve is also present. So guys, we have posterior circumflex humeral vessels here, and with that you will see the axillary nerve also, the 2 contents of these spaces here. The PCHA, posterior circumflex humeral artery, vein will also be there, just vessels, posterior circumflex humeral artery and axillary nerve. So these are the contents of what space? That's the content of quadrangular space. These are the contents of quadrangular space. The largest space out of 3, the quadrangular. Then look at this space here, that is the upper triangular space. This upper triangular space is very close to the lateral border of the scapula. So do you remember any blood vessel which was winding around the lateral border of scapula and participating in the anastomosis also? And that was the circumflex scapular artery. Circumflex scapular artery is the one which can be seen in the upper triangular space. Let me write it here. This is the circumflex scapular artery. I hope you remember circumflex scapular artery was derived from, it was a branch from the subscapular artery. So this circumflex scapular artery is the content of upper triangular space. It is the content of the upper triangular space. Lower triangular space. Now look at this lower triangular space. Again, try to understand this. Nothing to mug up here, guys. Lower triangular space is basically, it is allowing the content of axilla to leave and go at the back of the humerus. Now at the back of the humerus was the radial groove or spiral groove. Now, what is the content of the spiral groove? It was a radial nerve, and running along with the radial nerve was the profunda brachii artery, and that's how they reach posterior. The radial nerve will come out of this space, along with the profunda brachii vessel will also come out from here, and that's how they will continue the journey backward into the radial groove or spiral groove. So this groove will be having the radial nerve in it, this lower triangular space, along with the profunda brachii vessels. So we got the profunda brachii vessels along with what? Along with the radial nerve. And they are the one which are emerging from what space? They are emerging from the lower triangular space, a third, that is lower triangular space. So these are the three spaces that we see formed between the muscles of the scapula and the humerus. The intermuscular scapular spaces, the quadrangular space with the two contents there, PCH and axillary nerve, upper triangular space with circumflex scapular artery. Not always circumflex scapular artery is present inside. Sometimes you may see circumflex scapular arteries piercing the teres minor muscle and coming back. So you may not have any content in the upper triangular space. So it's not necessary that to have that artery in that space all the time, not necessary. Okay. Lower triangular space is having the radial nerve coming out of it, also the profunda brachii vessels. So these are the three spaces in there. Let me try to show you the same spaces in one of the atlas image, and that will be good for the comparison sake. Now look at this picture, guys. This is a picture which is showing you all the spaces and the contents in there. Now let's identify the muscles first. Well, what muscles do you see in there? This here is the teres minor. That's a teres minor muscle. You can see it is attached to the lower part of the greater tubercle, the teres minor. Look at this teres major muscle. You can see going that, and I told you it is going anterior to the humerus because it has to go toward the medial lip of bicipital groove. So this one here is a teres major muscle. And look at the one which is overlapping it and coming down. That is the long head of triceps. That's a long head of triceps there. If you look at this space here, that is a quadrangular space. That is a quadrangular space here. This here is a triangular space, and there's another triangular space which is present in there, right? Once again, if I enlarge this for you, look at the contents. I don't have to label them. What content, guys? What is the nerve? That is the axillary nerve coming at the back, and that we have posterior circumflex humeral artery. You can see the structure which are winding around posteriorly to the surgical neck of humerus. Over there, we can see the artery over there. That is the circumflex scapular artery in that space. And in this, you can again see that is, I can see this nerve and artery more clearly if I just put a incision here and separate this medial head and the lateral head of the triceps, a long head of the triceps and medial head. If you separate them, then you can see the content running clearly in the spiral groove. You can see a nerve over there, that is radial nerve, and the blood vessel, the artery that you say over there is the profunda brachii vessels. So this is about the intermuscular scapular spaces.